Okay, so I'm talking to you today about COVID and the vaccine, and I tried to do it for being really up to date right now. I was working on this presentation this morning just to make sure it was like the most up to date possible. So first of all, who am I? I'm Kady Goldlist, as Mary said. I work at Mount Auburn Hospital in the Quimby Center for Geriatric Care, and I'm an instructor of medicine at the Harvard Medical School. And I call myself like a geriatric comprehensivist because I pretty much do everything that a geriatrician can do. I work in the hospital and in primary care as a consultant, and in nursing homes, so a lot of different things. And I do have a special interest in medical education, memory loss, COVID, and healthy aging. I actually was part of a group that published a paper in the American Oops, did you guys hear that? I think I was just muted. So I published a paper in the Journal of American Geriatric Society on COVID and healthy aging. So I do have a special interest in that as well. So as Mary said, I did a talk a few months ago, January 19th. Welcome back if some of you were there then. And at that time, I was talking about vaccine timeline, how the vaccine works, and how the vaccine was being rolled out in Massachusetts at that time. So we've come a long way. In January, the vaccine was in phase 2, and it was only eligible to those 75 plus or with 2 comorbidities. And today we're all the way at phase 2 with the 5th part of phase 2. So now I would think that most people here have been eligible and got the vaccine, and and not too far away, everybody that's an adult, 16 plus, will be eligible for the vaccine. And just comparing that to other states, by April 15th or later, most states will have all adults being eligible for the vaccine. So it's pretty remarkable the progress we've made, in my opinion, in the past 3 months for getting people eligible for vaccines. So I want to ask you guys, and let's open up the chat, about what you think compared to when I was talking last time in January, compared to 3 months ago, you feel, and you can answer as many of these you want and just write things that you want. You feel more hopeful about the pandemic, confident in the COVID vaccine, concerned about the pandemic, skeptical of the COVID vaccine, or anything. I would just like to hear about what you feel. Especially compared to 3 months ago, lots happened. So feel free to just write in the chat. I'd love to see, like, how do you feel? And it could be you can be multiple. Any multiple of these things could be written. Okay, so people are feeling confident in the COVID vaccine. Great, we're having more information, more time. Anything else? I'll wait for a couple more people. Okay, absolutely. And I'm going to be talking about the variants as well. Variants, yes. How about anybody feeling the pandemic? Do you feel more hopeful about the pandemic, or with time, is it getting more worrisome to people? And that's the difference between B and D. Hopeful. Good. Thanks, Mary. Fatigued. Absolutely. Absolutely. Okay. So, keep this in mind. And if you have questions about anything you've talked about in the chat, we'll get to them at the end. Okay. So about my outline, what I'm going to be talking about today, and I hope it answers a lot of your questions and keeps you informed. I'm going to be talking about the vaccine rollouts right now in the world and in Massachusetts, the definition of efficacy, the variants of the virus, what the definition of long COVID is, and what you feel confident doing if you're vaccinated, and questions that we still have pending, future predictions for the virus and what's still to be determined. So let's talk about vaccine rollouts. So right now, or as of April 10th, 754 million doses of the vaccine were given worldwide. And as of yesterday, the United States was number 8. I would say that's pretty good for us, our country, that we're number 8 in terms of how many vaccines we're able to give out. And there's, as you've probably heard, there's just a huge stark gap between vaccination programs in different countries, and many countries have still to report a single dose. So we're a little bit in a nice position in terms of that we're lucky to have so many vaccines. Now, in terms of Massachusetts, with regard to the United States, we're number 5 in terms of how we're doing with the vaccine rollout, which is, I think, also very good. A lot of people, and this is as of April 12th, so as of yesterday. And then just some more information, at least one dose, 44%, and fully vaccinated, a quarter, more than a quarter. And this is all from the New York Times. They have a great, like, up-to-date dashboard for these information that they're updating every day. And then just looking more specifically about where we are, most of us, I think, are in Cambridge or nearby, so Middlesex County. This is as of yesterday. There were 475 cases, which is honestly a bit of a plateau. As you can see, it's a little bit small, but this 14-day trend, it's kind of just plateauing. We're just consistently having this many cases. The biggest thing, though, is that the deaths have decreased. So we've been seeing that in Middlesex County and across Massachusetts. And if you note here that these areas are kind of the hot spots in Massachusetts right now, and I'll talk a bit about that later, but we do see some more positivity in terms of the virus there. Okay, so I talked a bit about the vaccine rollout. Now let's talk about the definition of efficacy. And I want to talk about this because I do hear people throwing around these percentages a lot, and I'm not sure if they know what it means because it is a statistical term that a lot of us have not learned. So I'm going to try to explain it with a video that I think really that puts a diagram, puts it into perspective. And so hopefully this will help you understand what efficacy means so that when you're talking about the vaccines, you know where that's coming from. And really, a lot of people think the efficacy means that if it's 95% efficacicious, that 5% of the people who get the vaccine will get COVID-19, and that's really not correct. So this will try to clarify that.
Efficacy rate is calculated in large clinical trials when the vaccine is tested on tens of thousands of people. Those people are broken into 2 groups. Half get the vaccine and half get a placebo. Then they're sent out to live their lives while scientists monitor whether or not they get COVID-19 over several months. In the trial for Pfizer-BioNTech, for example, there were 43,000 participants. In the end, 170 people were infected with COVID-19. And how those people fall into each of these groups determines a vaccine's efficacy. If the 170 were evenly split, that would mean you're just as likely to get sick with the vaccine as without it. So it would have a 0% efficacy. If all 170 were in the placebo group and 0 people who got the vaccine were sick, the vaccine would have an efficacy of 100%. With this particular trial, there were 162 in the placebo group and just 8 in the vaccine group. It means those who had the vaccine were 95% less likely to get COVID-19. The vaccine had a 95% efficacy.
So efficacy is a measurement of risk for the person. So the 95% is a measurement of how much the vaccine lowers the risk of an outcome.
Efficacy rate.
And then just like, so that slide and video was talking about the Pfizer clinical trial. So a very specific time where they did this vaccine in the real world with these placebo group and the vaccine. But I want to know, since Pfizer and Moderna have been in the general population in real life in different times, how efficacious has it been? A lot of people have been asking that. So there was 2 studies that have been going on since the vaccine rollout. There's one in Dallas at the University of Southwestern Texas, and there's 16 hospitals in San Diego and Los Angeles that have been studying vaccine rollout and how efficacious it is. The Dallas one is between December 15th and January 28th, where they looked at how the vaccine was doing, and the San Diego and Los Angeles one was December to February. And they really found that the efficacy of the vaccines is maintained outside of the clinical trial setting. So that's really reassuring, especially if you guys remember during December to February, that's when there was another surge. That's when things were really bad too. So the fact that the vaccine was seen in real life having a good efficacy is also really telling and very reassuring. So now a lot of people will say, oh, this one has a higher efficacy, so should I try to wait for that vaccine? Like which vaccine should I choose? And I have another 2-minute video that kind of explains which vaccine is best.
One-to-one, head-to-head comparisons between vaccines. They need to have been studied in the same trial with the same inclusion criteria in the same parts of the world at the same time.
If we were to take Pfizer and Moderna's vaccine and redo their clinical trial at the same time that we did J&J's clinical trial, we might see quite different efficacy numbers for those.
These efficacy numbers really just tell you what happened in each vaccine's trial, not exactly what will happen in the real world. But many experts argue this isn't even the best number to judge a vaccine by anyway, because preventing any infection at all is not always the point of a vaccine.
The goal of a vaccine program for COVID-19 is not necessarily to get to COVID-0, but it's to tame this virus, to defang it, to remove its ability to cause serious disease, hospitalization, and death.
It helps to look at the different outcomes of an exposure to COVID-19 like this. The best case scenario is you don't get sick at all. The worst case is death. In between, there's being hospitalized, severe to moderate symptoms, or having no symptoms at all. In the absolute best circumstances, vaccines give you protection all the way to here. But realistically, that isn't the main objective of COVID-19 vaccines. The real purpose is to give your body enough protection to cover these possibilities. So if you do get an infection, it feels more like a cold than something you'd be hospitalized for. And this is one thing that every one of these COVID-19 vaccines do well. In all these trials, while some people in the placebo groups were hospitalized or even died from COVID-19, not one fully vaccinated person in any of these trials was hospitalized or died from COVID-19.
So when people ask me which one to get, I'll say whichever one is offered. That's what that's showing. That's why I believe that.
One-to-one.
So I saw, Chuck, thank you for saying in the chat that you're concerned about the new J&J pause. I think a lot of us are. It's like the headline in the New York Times today. This is the headline from this morning. So what it's showing is that 6 people in the United States, I think hopefully, or most of us are not in this age range, had a rare blood clot disorder. And so they did pause the Johnson & Johnson right now from being administered. Now, if you got the Johnson & Johnson vaccination, should you be worried? My answer would be no. This is a very rare disorder. And if you read recently about the AstraZeneca vaccine, there was a similar scare about it. And they just wanted to see how to compare it with people outside of the vaccines and just make sure that it was safe. And honestly, it's such a rare side effect that it shouldn't stop somebody from getting the vaccine. And the AstraZeneca is still being administered. So the Johnson & Johnson does use the same technology for how the vaccine works to AstraZeneca. So I think we're just seeing similar things in terms of that rare side effect. But just because something has a rare side effect, in my opinion, the value of getting vaccinated and the likelihood that you'll get one of these extremely rare side effects is just so rare that I don't think that it should scare people. I think they just want to know more information about it, so they're pausing it to get that information. But again, if you've gotten the Johnson & Johnson, I think you should feel good. And we can talk about that more later. Okay, so there's also another. Okay, I'm answering. Claire asked, at what point does the side? So most of these is good question. Most of these blood clot disorders happen within 2 weeks after the vaccine. So that's what that's referring to. Okay, so another thing that's kind of hot in the news right now is delaying the second shot. And some other countries are doing this, and that's really because of the supply that they have. They don't have guaranteed vaccines that will come in the future in a few weeks. So they're just trying to get as many people with the first shot as possible. And I made this table to try to do like the pros and cons of it, because I think, there is so much uncertainty. We haven't studied just doing a single shot and what that means in a public health perspective. So the pros, I said, is that it uses up resources. More people need the first shot, so you can just try to give it to those people instead of trying to chase people for the second shot. It accelerates time to partially vaccinate everyone. It reduces serious illness and death because there is evidence that after one shot, there is some efficacy, not as much as the 2 doses, but there is some. And you like that video said, the point is to reduce deaths, to reduce hospitalizations, and then people, might have a little bit of a cold, but most of us are okay with that, I would think. And then other countries have done this, and they are seeing right now drops in new cases, which, right now we're seeing spikes in the Midwest and in cases. So we're kind of desperate to have these lower cases now too. So kind of that looks appealing in a sense. However, the cons is that when you have partial efficacy, you may be more vulnerable to variants, because how variants work is they take advantage of a body not fighting off the virus to kind of bypass the immune system and then spread. So if you're not going to be have a good efficacy, then that may happen. Again, speculation. And then with the speculation, we don't know a lot. There's not a lot about this. This hasn't been studied. It was in the trials, it was with the 2 shots, the Pfizer and Moderna and AstraZeneca, all those. So we just haven't studied it. There's not much known. And then, Britain says like they're seeing a drop in cases, but that's right now. What about months from now? Are we going to see a rebound in cases if people only got 1 shot of a 2-shot vaccine? Okay, I'm going to pause for a second to answer Hilden's question about why are they stopping to give the J&J vaccine. So whenever there's like a scare in a medical intervention, they want to like dial it back to like look into the evidence more. So there's a scare that they saw these rare blood clots. That's something that is like unique, right? So they want to like take back the evidence, like see why this is happening, and is this something that they have to put like on the label, like have to reevaluate, or is this just as common in the general population as it is? So they just want to like be able to investigate it more. So that's why they stop it while they're investigating it, because there's any worry, they're going to do that. But in my opinion, it's so rare. It doesn't apply to most of this population that's here with me. Most of the people who have gotten the vaccine, it's been more time, that I don't want people to be concerned. And I don't want people to get scared of getting vaccinated, because I think that's really important at this time.
There's also another question.
Yeah, I see that too.
Do you see that?
Chuck,
okay.
So Chuck, thank you so much, Mary. So Chuck asked delay about when to about when. Good question. So, so for the Pfizer and Moderna, I think they only studied a delay from 42 days between the 2 vaccines. So I think they're talking about more than a few months, if that makes sense. So they're talking about like a pretty long delay, because when they did study the 42 days, from what I can recall, it was still efficacious. But so also like just getting 1 vaccine, if you're waiting a long time and not getting the 2nd vaccine, like that's just not going to be, you're not going to have a good efficacy. So even that waiting time, like you're not fully vaccinated until you get the 2nd vaccine. So really like, it's just not the same. Does that answer your question? I'm just saying delaying it in general, because we only know that you can be fully vaccinated if you've gotten that 2nd vaccine. So just not doing that and delaying it in general. Okay.
Yes, it does. Thank you.
Okay, you're welcome. Okay, great question. So we talked about vaccine rollout, efficacy, and we talked about, people have already asked about variants. I think that's a really good question, because we are seeing in the news more. And I'm just going to talk about the top 3 variants. There are more that have emerged, but these are the 3 that are in the news. So the B.1.1.7 started in the UK and is now accounts for almost 20,000 cases in 50 states here in the US. So it's almost become the dominant strain here. And it is worrisome because it is more transmissible and does increase mortality. And then the B.1.351 came from Southern Africa. And this one, I remember when I showed you that diagram of Massachusetts, the red Nantucket, and the Cape is also a little bit, has more cases. So as of last week, there were 80 cases of this variant seen on the Cape, which is pretty alarming. And then the P1 comes from Brazil, emerged in January 2021 is when we found it. And we're not sure about the vaccine for protection here, and I'm going to talk about that in the next slide. So this is the one that people are really talking about a lot right now. This one is becoming a problem, and this one's becoming a problem. So does the vaccination protect against variants? That's what people want to know, right? Most of us are vaccinated. Do we need to be concerned? So we're pretty sure for B117, the one that's more transmissible, the one that causes more mortality, that the vaccine that's out right now should be okay. Again, we're not certain, but the data that we have as of now says that it should be protecting against it. We're pretty confident in that. Now, these other two variants, the mutations in them are the vaccine, we're not sure covers them and can help you against them. So that's a little bit more concerning. But recently in the Journal of American Medical Association from the April edition, Dr. Rochelle Walensky of the CDC said that the mRNA vaccine, so that's the Pfizer and Moderna, can be easily tweaked to these variants. The pharmaceutical companies are already working to see if we can tweak to the variants so that down the line, if we need a vaccine or a booster, we are ready to go. So these variants are really the virus making a mutation to try to bypass your immune system. And the vaccine tries to stimulate your immune system so that when a virus comes, it gets it before you show any symptoms. So we hopefully, because our vaccines are so advanced in the molecular biology, we can tweak them to be able to recognize these new variants. And these names are actually tell us about how they're mutated. So we know how they're mutated. So we can tweak the vaccines, hopefully, and be able to get them to help protect ourselves against them too. Okay, so now I'd like to talk about long COVID, and I can see you guys. How many of you? I can see most of you. How many of you heard about this long COVID? Is this something familiar? Okay, I see a few hands. And even if you know about it, I hope to share some information because it's a really emerging thing right now. So I'm going to tell you what it means if you don't know about it too. So a lot of us know somebody that's had COVID. It's really big deal. So long COVID is really life after COVID. There's no exact definition, but it's persisting symptoms after you've recovered from COVID. And so there's no exact definition, but it's after the infection, you have some sort of vague, non-specific symptom that can last for months. And so from the April edition of the JAMA, the Journal of American Medical Association, I really liked this quote from Dr. Piot, who was in London. He actually had COVID in April 2020, and he said, look, this is not just about a little flu. And if you're very old or if you have underlying conditions, then you end up in the intensive care and 1% die. There's a lot in between. I was hospitalized and I'd never been sick in my whole life. I had no underlying conditions, but it took about 5 months before I could start running again slowly. So you'll see that when people have COVID, afterwards, they can't exercise the way they were doing before. And there's actually guidelines on how you get back to exercising because it is very dramatic. So what kind of symptoms do we see with long COVID? These are the most common ones that we see. There's like so many, dozens. The most common ones we see are fatigue, shortness of breath, joint pain, chest pain, cough, loss of smell. A lot of my patients have been talking about brain fog, which I don't know if you know anybody with like Lyme disease, like kind of they talk about the same kind of feelings, similar symptoms to people that have Lyme disease. They compare it to a lot. You'll hear a lot about exercise intolerance. And right now, unpublished data suggests that as many as 1 in 50 or 2% of all people infected have long COVID symptoms after 90 days. And at Mount Auburn Hospital, where I work, we've actually started a long COVID clinic. That's an interdisciplinary team that I'm a part of that has pulmonologists, neurologists, infectious disease, geriatrics, and we'll see patients, we'll take referrals for these persistent symptoms to try to help people with supportive care, usually, to get through these dramatic symptoms that can be very disrupting. Okay, so now, if you're vaccinated, what can you feel comfortable doing? I'm going to try to touch on this a bit. So first, let's define fully vaccinated. And I kind of alluded to this when I talked about that single dose, that you're only vaccinated if it's 2 weeks after your second dose in a 2-dose series. So that's like Pfizer, Moderna. So 2 weeks. So if you're 1 week after the second dose, you're not fully vaccinated. If you're between the 2 doses, you're not fully vaccinated. and then 2 weeks after the single dose vaccine. So this is from the CDC, and I really try to get my information from like experts like in the field, like Dr. Fauci and Rochelle Walensky or the CDC. Those are the places that you can trust. You have to be very careful with what you trust. And honestly, on purpose, a lot of the guidelines are vague because they don't know and they don't want to give people information that could be harmful. So if you're fully vaccinated, this is from the CDC, they say you can visit inside a home or private setting without a mask with other fully vaccinated people of any age. You can visit inside a home or private setting without a mask with one household of unvaccinated people who are not at risk for severe illness. You can travel domestically without a pre or post travel test, travel domestically without quarantining after travel internationally without a pre-test, depending on destination, which is really important, and travel internationally without quarantining here after travel. Now, the you shouldn't is visit indoors without a mask or with people at increased risk for severe disease from COVID-19, and attend medium or large gatherings, which, you know, that's kind of vague in itself. And I would say anywhere more than like 10 people would consider a medium or large gathering, but it's difficult to say. So now this is from the mass.gov website about just a diagram about showing that fully vaccinated people with unvaccinated people. So this is vaccinated and unvaccinated and low risk can be together without masks inside.
Dr. Goldlist, I just wanted to interrupt because we did have one question in the chat.
Sure. So
yeah, if you want to
Rose
check it.
asks, what about serious mental health long COVID symptoms? That's absolutely, anxiety and depression is a really important one. And it was not on the top 5, but it's close to the top of them. And it is, we see it. So, and even like increased suicide with people that have COVID-19 after they've recovered. We've heard these stories. So that's a very important symptom that can be related to the COVID infection. We have no reason not to believe that that's one of the long COVID symptoms. And it is very serious. Okay, so now international travel recommendations. So this is from the CDC as well, and it just compares fully vaccinated to not vaccinated people and what you can bypass if you're fully vaccinated according to the CDC. So if you're fully vaccinated, you do not have to get tested 1 to 3 days before traveling out of the US, and you do not need to self-quarantine after travel for 7 days with a negative test or 10 days without a test. So that's a couple things that if you want to travel internationally, you can do, but again, it really depends on where you're going for how you have to act when you get there. So this is from last night, CNN, Dr. Fauci was interviewed by Wolf Blitzer, and I think that's really important. As I mentioned, I try to listen to like the experts that I trust and the CDC, and people want to know, what is he doing now that he's fully vaccinated? So this is a good interview. It's on CNN.com. So pretty much Dr. Fauci says that if you're vaccinated, fully vaccinated, you're at extremely low risk. And it really depends on the kind of person you are. Are you a risk averse person, or are you okay with taking a little bit of a risk for, the benefit of normalcy? And he also just talks about the level of infection in the community that you're in and how that kind of mitigates how much of a risk you're taking. And exactly why I want people to be vaccinated, to try to limit the prevalence in an area. So like Wolf Blitzer asked, would you eat outdoors in a restaurant? And he answers, well, I don't have time to eat outdoors. I'm like rushing from one place to another. So I get takeout, but I would be okay with it. I think, what Dr. Fauci kind of says in this interview is being outdoors is really, and fully vaccinated is safe. It's safe. So it just depends on how risk averse you are. If you don't care about eating outdoors and you just want to be as safe as possible, then you will choose that. But it's really how you live your life and what's important to you. Okay, so now we're getting to near the end of my presentation, and these are some questions that as of now we're still thinking about. So future COVID life to be determined. So we know a little bit about how effective the vaccines are against some of the variants, but we're still learning. And we still have to adjust some of the vaccines, we would think. How about how well do COVID vaccines keep people from spreading the disease? So there is pretty good evidence now that there is decreased transmissibility when you have the vaccine, but we're not certain that it's like 100%. So that's something that you do have to think about. And that's why vaccinated people can be in a household with low risk people and not high risk people. We don't want to take any risk with high risk people. How long vaccines can protect people. We can only study the vaccines in the real world for how long they've been out there. So, we just continue to study it to see the effects of how long the protection is and how robust the immune response is. And then booster shots. And we think right now that by the fall, we'll have enough information to know whether we need a booster or not. So that's good. So that's, in the next few months, we'll be hearing about, do we need a booster or not? And we can't know that right now just because of the studying in real life. So now I want to have time for some questions. I do want to talk about one other thing for a moment that's on a separate note.